After treating over 40,000 patients at Level 1 trauma centers, community, and rural hospitals, I know exactly how you're going to die. The deaths of almost every American, male or female, can be placed generally in 3 categories. Take for example Luke Skywalker here, a middle-aged person who represents you and whose life and ultimate death will follow into one of these paths. The first pathway is trauma, and we'll spend just a brief moment on that pathway and how to avoid it. The second pathway leads to the common offenders in the United States like coronary artery disease, cancer, stroke, diabetes, which ultimately in the United States on average will occur in your 7th decade of life. However, did you know that if you actually make it to your mid-70s, your new life expectancy is actually your mid-80s? You get an entire free decade of life. And that actually takes you down pathway number 3. And helping people get to pathway number 3 is the goal of this short series of videos. Because as I mentioned, as the research shows, if you make it to age 76 in the United States, your new life expectancy is now 88. And if you make it to 88, your new life expectancy is actually a few years beyond that. It turns out in the United States, for every year of life you live, significantly increases the chance that you are going to continue living. And in subsequent videos, I'll talk about how to make that last decade of your life one of the best ones, completely avoiding that steady functional decline and ultimately the nursing home dwindles that we all fear. And it is totally possible. For example, this is my father celebrating his 87th birthday earlier this year. And just a few weeks ago, he was teaching his grandson how to throw a baseball. Having a happy and healthy end of life is totally achievable. Getting back to the trauma pathway, fortunately, we don't have to spend a lot of time on that one. To significantly decrease the chance to have an untimely traumatic death, you really just need to make smart decisions. For example, when you're driving a car, wear your seatbelt. If you're on a motorcycle or another activity, put your helmet on. And you might want to consider walking your dog around lakes in Central Florida. Making wise decisions will generally keep you out of that pathway. And by the way, did you know that research shows the most common way to die in a car accident is not on a highway or on a backcountry road? It's being T-boned on the driver's side when you're crossing an intersection. That's why it's super important to just look to the left when you're crossing over the street. Fortunately, most people make those smart decisions because they really don't want that premature traumatic death. What's incredibly interesting is you can also make smart decisions to keep you out of this pathway, yet we don't do them. We will gladly put on our seatbelt so we don't die in a car accident, but we won't put on that medical seatbelt so we don't die in this pathway. And that's what we're going to talk about today. There are a lot of reasons people don't make those smart decisions, but I think one of them is they're putting too much faith in the medical community. You'll understand why my medical colleagues and I are really good at treating traumatic injuries and bacterial illnesses, but remain pretty crappy at treating illnesses of prosperity such as coronary artery disease and diabetes. Shift after shift at work, I see people taking medications for their hypertension, their diabetes, their hypercholesterolemia, and shift after shift at work, I see these same people ultimately succumbing to the illnesses that they're taking medications to treat. I mentioned in the last video we would talk about the medical seatbelt to keep people from going down this pathway. And what it is so cliche, it almost seems trivial to make an entire video series about it, but the data continue to indicate beyond a shadow of a doubt the 2 things that will help you more than anything, more than any medication that has ever been prescribed, is diet and exercise. This might seem harsh, but if you don't have the discipline to diet and exercise on a daily basis, this is how you're going to die. And even worse, for most folks in this pathway, the years preceding that ultimate death is riddled with doctor's offices, hospital visits, inpatient rehab stays, or as I mentioned at the beginning of the video, the dreaded nursing home. After treating over 40,000 patients, I continue to see this almost every single day. But the reality is, for most people, you can significantly decrease the chances you go down that pathway the same way you significantly decrease the chances of dying by trauma. It takes discipline though. Let me give you 2 examples. I'm going to tell you the story about a patient who is a 57-year-old female. She's 5'8" and she weighs 232 pounds. She is already suffering from hypertension and type 2 diabetes. She is currently on essentially maximum medical therapy, but as I mentioned, she is still suffering from hypertension and diabetes. These medicines are not curing the illnesses. Do you see the point I'm trying to make? If you go to your doctor with pneumonia, he gives you antibiotics, you will most likely be cured of the pneumonia. In cases like diabetes and hypertension, you may go to your doctor, he may give you medicines to treat diabetes and hypertension. However, without the discipline on your part, you will unfortunately continue to have diabetes and hypertension. Anyway, this patient is 57. Statistically speaking, she is about 15 years away from her expected death. During this time frame, she will have decreasing bone and muscle mass, and unfortunately without changes, she will likely become increasingly obese. She will get to a point where her joints and mainly her knees will become increasingly painful and she will become increasingly sedentary. She won't be outside and active with her grandkids. She will likely be getting around in a scooter or a wheelchair, or she will put off the wheelchair for so long until ultimately her lower extremities give way, she falls, and she breaks a hip. And as an aside, this just happens to be a female patient. This is not sex exclusive. The same thing happens to females as it does males. Anyway, she will break her hip, she will likely require surgery, and because of her overall poor state of health, it'll be somewhat of a more high risk and complicated surgery. She will have a longer period of time in the hospital. During that period of time, she has an increased risk of getting urinary tract infections, catching a pneumonia, increasing to her overall state of debility, and hopefully she survives all of that. But because of her now increasingly deconditioned state, she will go to a short-term rehab where she might have these same complications. It's a terrible cycle. And in the case of this patient, you can see she's already been through this experience once, and unfortunately now she's fallen and broken her other hip and has to go through the same thing again. Each one of these experiences, each hospital stay significantly decreases the amount of quality time she has left in this life. One more case I want to share is that of a 16-year-old boy. He is 5'10", already weighs 260 pounds. Without a doubt, he already has metabolic syndrome, and at 16 years old, without significant lifestyle changes and modifications, he is already on this pathway to death. This is how he will die. Assuming he avoids trauma, and assuming his bad habits don't lead him to a massive heart attack at a young age, he will die in his 70s with the last decade of his life being pretty miserable. Now, if you're watching this video and you're thinking, well, that's never going to happen to me, that might be the case. There are some incredibly lucky people out there when it comes to health. Some people can smoke their entire lives and never get lung cancer. Some people can drink every day and never get liver cancer. But if you just look at the statistics, it's not going to be you. So why am I making this video now? Well, as I start to incorporate more healthcare videos into this channel, hopefully that'll be explained in the next series of videos. I'll talk much more about the diet and exercise and how to make that last decade of your life much better in videos down the road. If you made it this far in the video, hit the like button, and Luke and I will see you in the next video.